Another fascinating topic is glandular therapy, or live cell therapy. It was discovered many years ago that if you suspended an extract of cells from an animal and gave it back to a human being by injection, you could ameliorate the symptoms that were generated by that person's loss of an organ. I believe this was first done with the parathyroids. The parathyroids are small glands that sit right in the back of the thyroid here, and sometimes they can be damaged or removed during thyroid surgery. And the first researcher who looked at this ground up some parathyroid tissue from an animal and injected it into a patient who was having severe reactions to low calcium because his parathyroids had been damaged or removed, and he recovered. The concept here, and this was pioneered by a man named Nihans in Europe, is that the cells, when prepared properly from an animal, convey an energy and a nutrition to a target organ. The cells were radio-labeled with a radioactive isotope and then administered by injection. It was found that the radioactive isotope did not just diffuse throughout the body haphazardly, but concentrated in the target organ. In other words, if you had a gland of thyroid that was a glandular material of thyroid that was radioactively labeled, the radioactivity would concentrate in the thyroid as if the body in its own wisdom knew where to take the energy and nutrition of that substance. In Europe, this was given for many years. Many Americans went over to Europe because it was not easy to get in this country for rejuvenation therapy to help their immune system or help revive organs. There is a large variety of glandular therapy. There is oral therapy with glandulars that come from animals. It could be liver, it could be adrenal, it could be heart, and they all contain nutrients and factors that help support that particular organ. In Germany, there's a product called Regenerescin. It's pronounced in German Regenerescin. It is ribonucleic acid, which is extracted from organs and given back to a patient, and the ribonucleic acid activates the synthesis of proteins that otherwise might not be present due to a genetic deficiency in the human or organ failure. I have seen this work. It can be especially useful in genetic diseases. In Europe, they would also take suspensions of cells and give it to patients for heart problems, liver problems, adrenal problems, and the idea is to imbue the organ with more energy and vitality. Is there validity to it? Yes. Is it a cure-all? No. It's much cheaper to take by mouth, the tablets. The injections are more expensive. They are now available in this country in various forms, but it would have to be administered by a doctor, and there are only a few preparations that are available due to medical legal reasons. But many patients are interested in this, and you don't have to leave the country anymore to go to Mexico or Europe, because there are preparations that are available by injection here that can help you out.
Great.